The first one we say chickenpox. I think this illness name, like lot of people pretty familiar with. And in the children time, lot of the children got these problems before. Chinese name is 水痘. 水 is the water. Water kind of 豆 usually we talking about beans, but this is not truly beans. It's kind of thick kind of beans. Just means small bluster in there and water inside. So that's generally for this illness name. Then we're still talking about what means chickenpox. Chickenpox is a very common one, children's illness. So basically, it is acute infection kind of illness and still can cause the skin rash. It's basically a seasonal kind of pathogen invading. So clinical symptoms, fever, and then itchy and dark red kind of skin rash. Later on, development to blister. And after recover, it's scars there. So that's basically, and some of them skin rash affected is the mucosa membrane there, like inside the mouth. So in West medicine, they call chickenpox or varicella, because this illness basically they cause the two problems. First infections is chickenpox. Second infections, that will be like we talking about hypers. That's the same virus, yeah, same virus, and cause the two different kind of illness on different time. And it is an illness transmitted by the air droplet. Generally speaking, this illness, if people got chickenpox in the children, generally the symptoms is not that severe. But if some people never got chickenpox before, and then they got in the adults, the symptoms is much more severe compared with the children. So then we're talking about TCM etiology. What caused the chickenpox? So for TCM, we're thinking about the chickenpox mainly relationship with external passengers, wind, dampness, heat. It is a seasonal kind of passenger. So that's still pretty much we're talking about in the West medicine. And the mainly invading location is the lung and the spleen. Thus, the children is more weaker part, the organ. Lung governant, superficial of the body, defending qi. Spleen governant, internal TNT functions. So children naturally have these two organs deficiency there, and then with like external passenger evading. So that's pretty easily cause these illness. Then we're talking about the different pattern and with the treatment. Firstly, we're talking about the passenger attacking lung way, means defending Qi levels, superficial of the body. So mainly symptoms, we say maybe slightly fever, maybe no fever. And nose congestions, and maybe with discharging there, sneezing, and maybe cough. Pretty similar, we're talking about EPI, external passenger evading, like we're talking about common cold. But like after 1 or 2 days, and the skin rashes will start appear. So that's basically difference with generally common cold. They have special skin rash. So this kind of skin rash is kind of itchy. So skin rash is itchy and red color and moisty. And we can see some clear kind of fluid, like inside the skin rushing there, like a blister. So from beginning, maybe there's some fluid around the base area and then form the blister. So this skin rushing, it's not coming the same time. Some coming first, and then the other coming. When the other coming, the first coming one will be healing. So you can see different kind of stage, kind of skin rushing here. So mostly happens on the body part, on the trunk. If we're looking for the tongue let it be red on the tip area. Tongue coating still keep the same, not changing. Thin white coating. The pulse, floating pulse, and rapid. So generally say that still belong to EPI wind heat attacking, superficial. So our treatment principle, dispersing wind, clear heat, and also they can combination with some dampness there, with dry dampness. And that kind of severe heat causes skin rash. We can thinking about the toxin. So generally speaking, if the symptoms is not that severe, truly we are not necessary to treat. They will naturally healing by themselves. But if we try to relieve the symptoms, let it be faster, or maybe some children symptoms little bit severe there. We can use acupuncture, and also we're thinking about acupressure kind of treatment in it. If we give patient the treatment, so generally points still pretty similar, like we treat common cold, lung 7, gallbladder 20, and bladder 12, last two is the wind points. And we can use LI11 or maybe 214, clear heat. If truly some children have generally underlying body condition is weaker kind of condition, so their healing will be slow. So we can add in some tonified points, like a qi tonified points, stomach 36 for qi tonified. So that's for this pattern. When we're talking about pattern, passengers go to deeper, go to qi and yin level. Pretty similar last time we talked about other effect illness. So basically they will invading Wei level first, then go to deeper of the body, qi level. Is still recovered. They may go to more deeper level, yin level. So now passenger go to more deeper level, qi level, and yin level. So qi level basically is more stronger kind of heat. So that causes the stronger fever. Or maybe restless. And thirsty, like to drink water, that's excessive heat. And the red face, red eyes, and the skin rash go to more dark pupil color. Density means more skin rash coming out. And even with blister there. And also possible some blood kind of skin rushing. And blood, we talked about this illness before, like blister. Yeah, so red color and the skin caused some bleeding, yeah, and skin bleeding problem. So truly, this condition is more severe than first pattern. And the patient also may have dry stool because body fluid damaged. And maybe dark yellow urination. The tongue is red, dark red color, or maybe, and is more dry tongue coating there. Pulse is rapid and stronger, powerful. So basically, they're talking about passenger go to qi at the yin level, but here mainly is qi level. It's excessive heat go to internally. So treatment principle mainly we clear heat from qi level. But when we talking about the cooling in the yin level here, because truly we know when heat go to yin level always with blood level together, 血 level, thus can cause the bleeding. So truly we can see some bleeding kind of skin rash there. So thus we say heat also go to yin level and the blood level. So relieve toxins and relieve dampness. So truly this kind of pattern, we need to give some help, give some treatment. So the points, still coming from external passenger evading. We still use long 7 combination with LF4 together and goblet 20 wind points to 14 clear heat and also can relieve external. And the heat also possible combination with some dampness. So we use stomach 4 together. So that's basically we only have 2 patterns for TCM. That's basically relationship with shallow level, superficial level, V level. That level will not necessarily treat for the patient. And the second pattern, heat go to deeper level, go to T level and the yin level. So that's a little bit more severe heat in there. Truly, we need some treatment. So we say, why is the medicine for this illness still pretty similar? It's man case. So basically, nothing needed for the treatment. The children could be healing by itself. So that's the general purpose. But if patient truly is a severe kind of case, we may need some treatment. By patients have different kind of symptoms, like a high fever, reducing the fever. And if patient very severe kind of poor appetite, couldn't eating, don't want to eat, they may cause the dehydrated. So that's kind of situation truly we need to treat. Or maybe cause the bacterial infection kind of situation we need to treat. So generally we say most case, we are not necessarily treat for the children. But generally we need a little bit careful. Don't tell the patient scratching the skin. So that's we talked about last week. Children have like skin rashes, always itchy. Whatever you tell, don't scratching, they may couldn't follow. So cut the fingernails and with some gloves do some protections, especially for pretty young children. Yeah, you could put a gloves or using something cover for the hand. So just be careful for skin scratching there. And because if skin is scratching, that's pretty easily cause bacterial infections. And also, if pretty severe kind of itchy, we can thinking about use some lotion, topically use. That's truly can relieve some skin itchy. And if truly severe kind of skin damaged and severe case, we can use antibiotics. That's because we're thinking about that's bacterial second infection in there. And even for severe kind of like a case, we say naturally recover about 2 to 3 weeks. If like pretty severe after 2 to 3 weeks, still getting more severe and severe, we also can use antivirus medication. So that's why the medication treatment for chickenpox. Prevention. So prevention chickenpox, we say that's the illness, epidemic kind of illness. They have special seasonal like a transmission. So especially during that time, don't go to public place like some shopping or maybe some even kindergarten. So there's a lot of people there. Try not to go to there. And especially hospital. Yeah, hospital. Hospital is the place pretty easily caused infection. So that's try not to go to public place. And also, especially for pregnancy, yeah, pregnancy woman. Pregnancy woman, they are possible passing the virus from the mom to the babies and then cause the baby's problems. So in that kind of situations, like especially in epidemic seasons, and the pregnancy mom must be go to some place, they may be exposure to the virus. Thinking about give some immunity globin, especially against this virus. That belong to positive kind of immunity, like directly give patient antibody. So that belong to antibody. Antibody give for the patient directly working. So that's we say. And certainly for the children, yeah, for the children, still can give vaccine. We can give vaccine belong to active kind of immunity, but it must be after delivery. We couldn't give filters for the vaccine. So that's we give the mom some antibody to protection for the mom. That means protection for the filters. And if we truly know some children with chickenpox, so basically, that children will not sending to kindergarten, not sending to school, in case the transmission for the other children. And then we're talking about like clothes and some tools or environments, whatever, is contaminated by the chickenpox kind of infection kind of children. So basically need these infections. We have a lot of ways to disinfection. So depending what we need disinfection. If the clothes we can boiling, or maybe we can use some ultraviolet light. And maybe we have some other ways. We have some like drugs, disinfections. So that's about preventing. Then we're talking about nursing care. So basically, the children got chickenpox. We try to preventing it, got secondary infections. So basically, secondary infection usually is caused by skin. Because skin have rashes there and some damage there, bacteria pretty easily invading from the skin. So keep the skin clear and changing especially underwear clothes. And we talked about already, trim the fingernails, cut the fingernails, and use the gloves to protection to scratching the injured or damaged eye. So we need to be careful for some children. They may originally have some illness and get some treatment with some hormones. That kind of hormone decrease immunity functions. So that's pretty easily called chickenpox infections, and also pretty easily got severe kind of symptoms in there. So that kind of patient we need to be careful. But we couldn't directly immediately stop to use that hormone. Because if we suddenly stop that hormone, cause the other symptoms may be worse. So talking with the family doctors, maybe reducing some dose in there. Maybe need some other medications. So that's because these kind of hormone medication truly easily cause infections. So that's about this illness.